Assalamu alaikum. I'm Dr.Ishag Shafi. The Democrats ke faratum primary healthcare program genes den silsila programming Ocean TV network miedmi furatum episode alme fonwal. Alme mi program genes den je sabaki mihar primary healthcare bossulla fonna. Furto al danwan primary healthcare ki coach. Primary healthcare ki රයිතුන් ආම් සිහතක 12 සිහතක බෙහෙට්ටම ඔන්න ඉජ්තිමා යදි මෙඩිකල් සර්විස් ඒ ආම් රයිතා ෆොරතම කොන්ටැක්ට් ડોක්ටරා කරේ දෙන් ඉතුරු තහලීල් එහෙනුනි බේස් කරන්නම සෙකන්ඩරි එහෙනු ටර්ෂරි කෑර් ෆොනු මීග මුහිමුකමකි ආල්මෙන්ගේ ප්‍රයිමරි හෙල්ත් කෙයාර් බොස්සුන්ලා ෆොතීම ඒගේ සර්විස් එබ්බස් රයිතක ඉහසාස් නෝමියද එහෙම මියදක ප්‍රෝග්‍රෑම් ෆොර්තමාල්මෙන් ගෙනස්තේන අහි ජූන් ගාල්මෙන් මාෆ්‍රීගා බේබි ප්‍රෝග්‍රෑම් ඒ වර්ල්ඩ් ඕෂන් ඩේ ෆහක් කරන්නේ ඒ ආම්රයිතුන් සිහතා අදි කණ්ඩුග ගුලිෆයි මිම්බර් අදි හුරියා බේෆනෙන් වනාන ෆදහෙන් ආල්මෙනකි කණ්ඩ බර බොඩ බරෝසා වෙගෙන් කණ්ඩ මස්කාගෙන් අදි දිරුලේ බයි
Good evening, everyone. Assalamu alaikum. I'm going to present how important the ocean is to your human health. It's a primary healthcare approach to ocean health on our World Ocean Day today. So primary healthcare is the care from baby to old age within the community. That is the first contact with the medical doctor you have. If they're required, you're referred to hospital or secondary or tertiary care. Well, in primary health care, we take care of person's health care and social care in the community as well. So, including ocean, which means medical and social prescribings are carried out. As you know, Maldives is 99.6% ocean, hence primary healthcare scope is huge in ocean. Next. Well, regarding about me, I'm a primary healthcare medical doctor working in this area, including ocean. My practice includes clinic, home care, resorts, hotels, ships, boats, airports, travel, medicine in airplane, things like that. That's me. I've been in resort medical practice beside my clinic in Mali, and also during the pandemic, I've been in the ocean taking patients from cargo ships and all to the hospital as well. And I've been a paramedic in international movie production in the ocean as well. So for the Maldivians, the ocean diet is the primary thing in our country. So all ages take daily seafood, as we know. In pregnancy, daily tuna and other seafood. And in children, daily tuna, and in some middle age, daily tuna, some varieties like reef fish, as well as octopus. And in old age, is again tuna. It's always tuna, and few reef fish in our country. Next. So that's the tuna we eat. So ocean diet in the world, we have the highest per capita fish consumption in the world. So for us, the ocean is hugely important. The health of the ocean depends on our health as well. So the goal for the Ocean TV network is to conserve and protect ocean and our marine ecosystem, at the same time keeping everyone healthy by minimizing harm resulting from procurement and delivery of healthcare and increasing awareness of the benefits to everyone's health and well-being, ocean literacy with community involvement and education of healthcare professionals, health production agencies, and also oceanic health and collaboration with institutions and international organizations which have huge benefits for us and opportunities, and the risks are huge. The ocean pollution prevention, as you see on your right side, we have a thing called the ocean pollution berg. It's like iceberg. And the tip of the iceberg, like Pale just now showed, is the plastic. The plastic waste is number one at the tip of the ocean pollution berg. Then comes oil spills. Third is mercury. Four is manufactured chemicals, including what doctors prescribe to you, like medicines, chemicals, and other things we use in the hospitals. And five, the pesticides we use quite hugely in our country as well. And lastly, the nutrients. So the ocean pollution is widespread and it's worsening and is very, very complex. So the danger in human health is very, very clear due to toxins, microbial pollutions, chemicals, plastics, fisheries destruction, storm and flood. Now, the 80% originates on land from using ocean as a dumping ground. So this is very important point. So the ocean get polluted by 80% due to the dump we are using as a dumping ground for all chemicals and pollutions. This slide shows the ocean pollution prevention slide. If you see on your left side, there's a ship almost sinking. It may be carrying our healthcare equipments, including chemicals, medicines, and other things. So you can imagine the amount of pollution it can cause to the ocean if it sinks. And it's really difficult to prevent it going down. And then we have, the oil refineries. On your right, the burning ship is an incident which happened in Sri Lanka a few months ago. The ship burned and it caused acid rain in Sri Lanka. So it's very near to us, the events which are happening. And you can see down there, the plastic is the tip of the pollution iceberg. Next. This is some recent findings we found out. There's up to 1,500 tons of DDT found in dump of California coast. And then we have 67 tons of mercury in submarine sunk off coast of Norway. This is very significant finding, and we probably will have likely more surprises in future. This is regarding the ocean pollution prevention. And the planet is chemically different, totally. And than 100 years ago. Many have long half-lives. Like Pale just now showed, the plastic is the persistent organic pollution which remains in the ocean, and it keeps on contaminating through time. This is in borders. What we found out, our ocean food is largely safe, according to evidence we have seen so far. However, due to recent events which are happening around Mali and around the ocean in our country, like the beach construction causing, you can understand the amount of pollution which can cause the ocean as well. And a few days ago, we had a ship sinking. It had, kerosene and petrol in it. You can imagine it's pretty much same. It's starting in our country. So regarding ocean health and human health, if we take care of ocean health, our health will be, taken care of, because we are largely depending on ocean. So doctors, scientists have found out neurodevelopment effects in children like toxicity, causing autism, ADHD, dyslexia, affecting millions of children. So you can, as you all know, autism is very common in our country nowadays. Could be related to that. We need to find out that. So cardiovascular system effects like cardiac toxicity, immunosuppression causing more infections, and carcinogenesis causing cancer, endocrine and reproductive system causing fertility issues, and we are having fertility issues in our country as well, and metabolic and diabetes. And surprisingly, we are getting transgenerational effects due to toxins among humans. So for the interdependency, because the main food is from the sea, hence healthy food security is very, very important for us. Contamination of food chain is always a risk for ocean animals, plants, and humans. Social prescribing, which is carried out by primary healthcare doctors, which is like, giving exercise prescriptions. Like swimming is a whole body exercise to reduce weight, develop lean, healthy body to prevent diabetes and obesity. And early morning sun and vitamin D, as you know, we are increasingly seeing vitamin D deficiency in our country. And walking on the beach, Tai Chi, healthy this is very healthy for the old age people. And mental health and ocean viewing and so on. The science and complexity surrounding this, you can imagine the desalination, drinking water contamination, storms, sea swells, and tsunamis causing mental health issues. Recent findings found out it's affecting lots of children, unfortunately, especially the vulnerable children. A rise in temperature causing heat stroke. And there's an interesting, very, very interesting thing which happened like a month ago. Dr.If was a doctor who became 10 years younger by spending 93 days underwater, they found out. So we have his scope for, the tourist attraction for in case of scuba diving, or if you want to stay deep sea for a longer time, and it delays your aging. So regarding regarding the healthcare, so ocean healthcare is equal to human health. If you see the sinking ship, which could be carrying medicines, chemicals, and all, and it's very much related to throwing, gloves and medical equipment into the sea, and then we dispose from the hospital could be into the sea. So our country, though 99% ocean, the little 1% could be a contamination for the huge ocean we are having. We are highly depending on our food. So how to intervene this? There is lots and lots of benefits. Ocean care, we need to empower people how to take care of ocean. With co-creation, engagement with communities, business, NGOs, and government essential. Seafood and aquaculture for better health for everyone. Sea sports, like I mentioned just now, scuba diving, and activity lifestyle. So the doctors who are in the primary health care will be prescribing to keeping them healthy, and to prevent overweight and obesity, which leads to metabolic syndrome. Metabolic syndrome is unusual. You're getting larger, your weight increases, causing hypertension and other medical issues. So in Ocean TV, we can arrange Ocean TV networks, awards for Blue Climate Initiatives and our Blue Communities in Action. We can involve youth in UNICEF Youth for Climate Action. Regarding health sector and general practice, like I mentioned earlier, we have huge responsibility as doctors and medical staff. So because most equipments, medicines, and chemicals brought via container ships causing CO2, carbon dioxide emissions, accidents in the ocean reduction can be reduced, reduction of carbon emission from clinical work we do in the hospital and in medical practices. Lastly, medical tourism, we can attract tourists from around the world to the Maldives. So, thank you everyone. So primary healthcare intervention is key to ocean health and the human health. Thank you everyone.
And Farhan Kuriga primary healthcare oigotge nazarakun. Egota balar primary healthcare workers ero warang effective warang hardana. Eg mane ki Madiri control kurma komme duk heng gege gos Madiri control kurma program hinga. Mihar ko kamenne air kuri gotaki furotamano waltaka masla Madiri control kurani. Then found chlorine elima by mas marwe hem chlorine are friendly and chlorine elias dire mas gengolan feri. Egotuma swara rangala control kuremu. Then ekam Aedes aegypti kya madiri eti DDT air benum koram feri DDT chlorine fa DDT benum koram feri a resistant ya develop again a control then no way then mihar me gengolani fog system ga mizamanu ga era balar getang hunani barat tafat ko fentang hunani hamko valakono eki tanta feng hore stagnant wefa jama efa building tabuges construction tantanuges ehemi ma council takon community effort ek gota kuriga public health masakke kuri gota healthcare workers masakke kuri gota komme duku hen gos control nonjaka control and nuan mihar ehenas mikamiki warboda research kurave kame hasako madiri control korang africa gamutak seba research hada එම්මේ ෆහුගේ රිසර්ච් බලාරෝ ආන් දන්නෝගති මීවර රංගල් කමේ රාජ්‍යක ෆරම් මිහාර බයෙන් ඇෆ්‍රිකා ගම්තක ෆරා ටෙස්ට් එක වද ඒ ෆිරිහෙන් මදිරි ආමුකාල්මෙන් ගෑග දායගන්නනි අංහෙ මදිරි එක ෆිරිහෙන්ද මදිරි ඒ ස්ටෙරිලයිස් කරන්න ඉරේඩියේෂන් දී ස්ටෙරිලයිස් කරමකි දරිමා වුම්ගේ chance අංහෙ මදිරිය ඒරුන් නෝන්නා අරුමෙන් ගෑග මදිරි මිහෆනි ඒති දරිමා ලේ බෝම්බෙන් කුරා කමෙක් ඒක සයිකල් තරේ එහෙම විවාහගත කෙමෙ ෆොම් බිස්සලාර ඒ බිහෙ මදිරි එක බදලෙන් නොවේ මාරුවනි ඒ ගොතක් ගෙන් ප්‍රෝග්‍රෑම් ගෙන් ගොස්සියා කොම් හිසාබෙක මදිරිත මදවමු ගොස් හුස්වාන් මීවර ෆහුගේ ටෙක්නොලොජි එහෙම ආවුන ෆෙනේ මිහාර කාකන්ත ෆරන් ආල්මෙන්ගේ ටෙස්ට් ෆේස් කෙස් ආල්මෙන් ගාම කි මදිරි හා ගෙනීම වරනේ දේ බල්තක් ආවුන දන්නවානේ බල්තක් නන්තවස් ඒගේ එම්මේ මිහාරක එමෙ ෆහුම් මෙවලනි අනේ චිකන් ගුනියා මස්ල එකම මොලි ආහාර බලාරු ඩෙන්ගි අබදුලේ आदि जिका वायरस सामने फेन फेब्रुअरी तक कोल दुर जेलापिया ये दो फीवर वायरस फेन फेब्रुअरी एचपी एक डेटा है එහෙම වීම මදිරින් අර බලිත ආල්මෙන්ගේ හෙල්ත් කෙයාර් බජට් එක කුරා අසර වර බොඩ හැමකෙනි රයිතුන්ගේ සිහත කන්නෝ එහෙම වීම මේ ප්‍රෝග්‍රෑම් බජට් කුරේෆා කුරි බලාර ආන් දන්නවාන 30 දෙසැම්බර් 2011 ඒර්ග රයිසල් ජුම්හුරියා මොහමද් නශීද් එබලා 7.1 बिलियन राजघुरिहा रईतुन्न फुर्तम फहरा हेल्थ इंश्योरेंस आदि पेंशन फैसा आदि इतर एकनि बेरी मांगे हितरिकम फोरक दिनवा बजट को फावे मिहार मी थेरहर फहु बजट 49.8 ehnas era mihara balar aund fennu gadda public health kurave madiri control program adi ehni hen primary health care iha hardananno vima almen eba bikamage kuriya danje mihar emme nurakha baltaka madirin jehe ankurinus denne vi hen dengu chikungunya emme mati mihar emme gina mi feturani hospitata fureni geege sungada wege deven tanene ti geega tibeni ehema danna molani ane e viral infection e bima e deve farwa ki wara community level ges ad hospital level ges wara boda sabbis kadiru hen almen sarkarunna adi council ekama olege madiri control hogge noni control kurevani balta kennu e madiri hafafiyam baliara den ege terege itur baltak sebole misalaka file area almen kiyani imported by ekame kuring almen kannu fene madirin ara file area dan kol kuring yellow fevers feni february adi zika virus unje bali seburi feni ehemima almen mihara sarkano ekan nukodde bati e kurambi wara nukurave thi almen council adi rayitun gulige mikan we has effective kon adi wara program e gota muli ahara control kurave gota program taken nugenes madiri control kurun ei nadir kame ei ham kiriya ware kole behlar hafta de hafta tere madiri ginawan ehme e duas kolan adi andun target koggen council takun e bolenje adi sarkarum se bolenje hama gen ham komme du gosken control kureta ei kuriga almen komfori ekam program ege reflection ge mane ki almen kurin ko fori effective program gende on method di almen audit kurin ba fene ei kan me rangal goteki ehen ekan ehen nu gende venya almen ekun ebesiche dahen kurave ei wara basic level ge business inge ehem bi man kurin kuri methodology ehen uni gendiye program ge activities genda ge council takunna adi sarkarun ge waran ahamiyati kame di ekan e kuriye gendinje democrats ke sarkar ge primary health care kuriye gendani primary health care onna duniyege emme fahuge standard emme onna emme effective gota ege mane ki medical adi ijtimai kantata kuriye gendani primary health care level ege magut ke kuring anu denne mi public health workers sulen community narhun ulen mental health workers ulen adi doctor suluwan e team misalaka anu kuring denne vi chikungunya ehnu dengue hedi madiri masleka vijjam ebe from activate kuraban ehenuniam direct kuraban public health workers kos madiri control kuram mige magut ki almen database en erun ingene kom musume kan ginawani en durala tayyar gen tiben mihar e program enne kurin alun denne hen dehas 11 7.1 billion rupiah almen asanda program takachi from mihar 49.1 billion rupiah debakole bam almen ekan kurevidan er magut ki rayitum balimu maduwan madirin arab balta maduwan madiri jehe balta kan hunna ehen gos miha kuda gawmega mikan kurang almenaka almen democrats ke faraton alaka hienno ebbe sundago komen hen alonda bare yagin kombe ehema mi wagotu kiyanno primary health care mihar nethi madiri merum program ei emme priority emme bodu priority dige emme iskan digen kuran je kanta ege primary health care level kan no fen almen ocean tv program genester sms medveriko right na swal kurang jaga oe egotum miedu first swal almen asre ege gina swal alon jawab eru jehinas takrar kollan ei kongotetto emme rangali madiri marang alon dene kiya devij ei emme fahuge advance eki madiri sterile kogge misaka firi he madiri sterile korima e anghe madiri bissalagen darima nuwa ei emme fahuge den e swal ge jawaban dana mi chicken gunia emme rangal avas farwa ki khobato almen hpa mihar di phone guidelines almen practice korani danwani farwa deni ehenas agon base korani chicken gunia ga tindu yanna hun ei fena adi panadol beenum korane hun kana diam den annan balivi miha muligagarisma hulhulta dulawma faadulawma adi avana mifar peak ifar ada hilaf anzar tak fenum ei kudakon miha dilirisma ebne baanwanege waru kahi bani kisno e stage ga agun de practice ka himeni steroid down benum kuran first di engina patient rangalwe ehenas tibona ingwananwan egota treat no coffee yam anekas e bali boduwe eg mane ki first treatment rangal wa mihuma kanuje itra base koraka ekam first treatment difa steroid difa rangal nuwa mihuna salistu steroid di alme rangal kuram e steroid de jehin sabab ki madiri e vanna chikungunya ga virus ge almen amilla difai bar e dimag kore attack kore kurima difai bar almen ehen tantanna set එක හාසකෝ joints තන් ඒක හිමරන එක මිහුගේ එක හුළුත weak one ඒ හුළුතක බොඩ හසර් කුරන් kurima almen mideni steroid digen e control kuran kurima waguta ekko mulin e memory T cells daan ඒක මානේ ki den amelle difai bar e hultak kan attack no kara ehenuni wagote ahar wahar de ahar wahar sama e hultak gorissa vein ala hunnani eme fahogadi eme effective program treatment ki mi dannawani e alme practice kurani e alme primary health care ge salme e gota base kurani ehem bima kuriyan e program ta gan silsila tereng bi eki funny be from expert advice be from advice taka ekkon adi be from debba maudumata ekkon kuriyan hori program ta alme genes den waka dannawa bihar mi program nimala hisab sai alun hi kuran tibe from bar shaweri program genes tumu kama kuriyan ettaga almen genes de series program ge waka anekas takrar kon dannawa den e program almen genes deni le maccha diuma behe wato vima social media adi sms medwer ko beswal almena phone eden miafa itur program genes deni waka anekas dannamu alme program mi madan Assalamu alaikum warahmatullahi wabarakatuh